Okay, welcome. My name's Dr. Hugh Wegwerth, and today I'm going to be going over um, osteoporosis. And the reason why I'm doing this is because I've had a lot of my patients recently come in and say that they've gone to the doctor and they've had the bone scan done, and their number comes back osteopenia or osteoporosis, and they've had another one 2 years later, and it continues to get worse. So I really feel like I've come up with a very comprehensive webinar here on what you can actually do to get better from osteoporosis. At the end of the day, there's many things that you can do to get better and restore your bones so you don't have to worry about fracturing a hip in the future. So really what happens here is bone decline is normal, all right, but rapid loss is the issue. Now, when I was 30 years old, I had more hair than what I have when I'm in my 40s, right? So there's always some decline, but the thing is we want to be concerned about the rapid loss of osteoporosis. So just to give you a background on me, my name is Dr. Hugh Wegwerth. I practice in Roseville here. If you want to contact my office, this is my office number. This is my personal email address. I've been in practice since 1999, so over 2 decades right now. This is a picture of me, and this is a picture of my family taken on the 4th of July up at my aunt and uncle's house in New Richmond. So at the end of the day, there's really two approaches. So what I practice is what we call functional medicine. So what is functional medicine? Functional medicine is an individualized, custom-tailored program for your specific needs. So if I see 100 people that have osteoporosis, guess what? I'm going to come up with 100 different treatment programs because each human being is different. Just like no snowflake is alike, just like no fingerprint is alike. So when you look at someone's body, whatever problem it is, and today we're talking about osteoporosis, you have to look at and say, why is Miss Betty, why is Betty, why is Mary, why is Joan, why is Tammy having these problems? Why is Jill having these problems such as osteoporosis? So functional medicine is an individualized, custom-tailored program to fit your needs, dealing with lifestyle and supplements to reverse conditions. Now, there's really two approaches that you can take. This is approach number one, okay? This is the conventional system. So what I mean by this is you go to your primary doctor, they do the bone scan, and you have osteopenia and osteoporosis, and they give you one solution, which is what? Fosamax. Now, if you've done any research on Fosamax, this stuff is bad, and I'll go over and show you the research studies on this, but this is one solution. Okay, functional medicine in my office is polytherapy. So this is mono, means one, right? My approach here is a poly approach, meaning this. You have bone loss, so let's figure out why are you having bone loss. So in my office, when patients come to me with osteoporosis, thyroid conditions, autoimmune disease, irritable bowel, Crohn's disease, whatever it is, I've helped with all these diseases, I'm looking at them as a poly approach. So what does this mean specifically when it comes to bone loss? Okay, so let's look at your diet. Do you have a diet that is inflamed? Are you inflamed, right? Is your body inflamed? Do you feel like you have pain in your knee and then in your elbow and then maybe sometime it's in your neck? Do you just feel inflamed? Now, I'll ask people, do you feel inflamed? Everyone says, yes, I feel like I'm chronically inflamed. So if you're chronically inflamed, your bones are going to degenerate quicker and break down quicker. What's your vitamin D status? What's your vitamin K status? These are all things that I'm approaching when it comes to a functional medicine case, when it comes to osteoporosis. Hormones, what's your hormone balance? Just when we talk about hormones, women, you have a symphony of hormones, which I'll be discussing here in a bit. So you have to put your hormones in balance. There's estrogen, there's progesterone, there's testosterone, there's DHEA, there's your cortisol levels. Just with this one component here, there's literally like 6 different hormones that we're addressing just on this one component versus the conventional system. Oh, you have osteopenia or osteoporosis, let's give you Fosamax. I mean, this approach literally is a joke. Right? And when I go through the research, there is functional medicine in my office gets people well. Have you had the correct labs? when patients come to me, I'm doing lab testing. We need to evaluate what's going on with your body. So when you go to the doctor, I'll ask people, how many vials of blood did you get drawn? People say, oh, I had like 3 vials drawn. Like when patients come to me, I'm drawing anywhere from 12 to 14 vials of blood. Now, a lot of people say, dang, has anyone passed out? And no one's passed out, but I've gotten a lot of sick people well because we're doing the tests that need to be figured out. So you need to do a comprehensive evaluation to see what's going on with your body. Do you have enough hydrochloric acid in your stomach? And I'll be going over this in this presentation. Do you exercise? Right? Because anytime you exercise, you put, this is a bone. Let's just say this is a bone. Anytime you exercise, you're going to put weight on this bone. And once you put weight on this bone, guess what happens? You build more bone. Because anytime you put weight on something, it becomes stronger. Are you deficient? Do you have too much sugar? Do you have too much insulin in your body? Are you pre-diabetic? All these things need to be looked at. Strontium, this is a supplement that's a cutting-edge supplement that's coming out. This helps bone growth and developing bone. Have you had your homocysteine levels addressed? This is an inflammatory marker. This is a DNA marker. There's a lot of things that can be extrapolated from just basic blood work. What's your B12 vitamins? What's your magnesium? Do you have any GI problems? Do you have malabsorption? So when I look at this approach, the functional medicine approach, I'm looking at all these things here, coming up with a plan and figuring out why you have bone loss. Not just saying, oh, you have bone loss, here's some Fosamax, let's check in a couple years. So what are the different stages of bone loss? So here we have osteoporosis, we have normal bone. I learn by visual, so a lot of my stuff is visual. So we have osteopenia, which just means the beginning stage of bone loss. And here you can see the density of the bone. Then we have osteoporosis. Then we have severe osteoporosis. Okay, so when it comes to bone building and bone breakdown, there's a couple things, just basic fundamental things that we need to just understand. So the first thing is what we call osteoclasts. So osteoclasts break down bone. So in your body, we have things that break down bone, and then we have the things that build new bone, which are called osteoblasts. So how I'm going to phrase it here is the osteoclasts break down bone. This is the Pac-Man, or I should say Miss Pac-Man. If you remember back in the day, Pac-Man would go and eat everything. So how I remember this is the osteoclasts with the C here is the Pac-Man, and the Pac-Man goes and eats bone. Then we have the osteoblasts, and this is the bricklayer. This is laying down new brick or new bone. Okay, so we have to have a fine line between Miss Pac-Man and bricklayer. Now, what happens in this process here is this would be the healthy bone, right? So in osteoporosis, either A, you have too much Miss Pac-Man, or B, you don't have enough bricklayers, right? So that's going to cause a problem. That's going to cause an osteoporosis. Now, one of the things is a solution with Fosamax is, what does Fosamax do? So what Fosamax does, it does one thing. It slows down Miss Pac-Man's here. Let me just erase some of this here. Okay, so what Miss Pac-Man does here, so what Fosamax does is it slows down Miss Pac-Man so that the bone doesn't break down as quickly. Now you're probably thinking, okay, well that's a good thing. Well, it is a good thing if you slow down Miss Pac-Man, but at the end of the day, that's not the problem. Just this is good. This would be a visual. If you take Fosamax, the research shows that you're like a stick. If you have a stick outside and you let the stick become dry and brittle over a period of time, it's going to fracture quicker and easier. So this is what happens when people are on Fosamax, is it slows down the osteoclast. Guess what? It does nothing for new bone. So it doesn't put down new bone. So you're just preserving the same old bone that you have, and that old bone becomes very brittle, just like an old stick that's very dry, and you just gently bend the stick and it snaps in half. This is what happens with Fosamax. And on top of that, all the side effects. So these are the osteoporosis drugs, the biphosphonate drugs right here. And these are all the different classes right here. The best-selling one is Fosamax. So again, what this Fosamax does is just slows down Miss Pac-Man, but it doesn't address all these other issues right here. This is where we really want to get to here to reverse your problem, is address you on a functional medicine level and get to the reason why you're having malabsorption on the bone. So here's a clinical study. So this is brand new off the press. This is in 2007. So long-term biphosphonates, which is Fosamax, therapy and fracture in older women. So let's just read the conclusion right here. So in conclusion, in older women at risk of fracture, 10 to 13 years on, let's say, Fosamax, biphosphonates. So 10 to 13 years of biphosphonate use was associated with a what? Higher risk of any clinical fracture than 2 years of use. So when you get on Fosamax or these drugs, how long do you stay on them? You stay on them forever. So what this is telling you is people that were on these medications for 10 to 13 years, right? So the average age that they started these women on were 65 years old. So they followed these women, right, for 10 to 13 years, and these people that were on Fosamax for anywhere to 10 to 13 years had a higher risk of any clinical fracture than if they weren't on it. And this is a brand new study, right? Here's another one. You can Google this. This is all the side effects. This is the all the lawsuits that have been associated with Fosamax right here. Fosamax is a very dangerous medication. There's lawsuits going on here. So at the end of the day, Fosamax is not helping people. The research shows that is actually causing more fractures. And again, this is a brand new study, okay? It's causing more fractures for long-term use. Okay, so let's go over the bone scan, or what we call your T-score. So what exactly is that? If you've gone in and you've had an osteoporosis scan, I'm just going to kind of go over so you understand what's happening. So it's called the T-score. So the T-score is comparing you against a 30-year-old female. So we have a set standard, which they say that if you're 65, you should have a bone density of a 30-year-old. That's like the comparison level. So here, if you're 30 years old, your T-score should be 0. So right in here, you see this green right in here. So right in here, at 30 years old, you should have a T-score of 0. Now, as you age, you're going to go down this lot right here. Down right here, okay? So what happens here is this osteopenia area would be -1 to basically 2.5. Sitting right here at 2.5, you're considered that you have osteoporosis. So you have osteopenia, right? And then osteopenia moves into osteoporosis. So I just wanted to give you an understanding of the scan, that you're actually being compared to a 30-year-old woman. So in the beginning, what we really are concerned about is how quickly your bones are becoming osteopenia or moving into osteoporosis. That's the concerning thing, is how quickly that is happening. And that's why these scores every 2 years are critical, because it will show you are you actually making new bone, or is your bone continuing to degenerate? This is a really good visual right here. This is normal bone density, and this is osteoporotic bone density. You see here, this is the 0. So this would be the 30-year-old. And then here we see that we go in the osteopenia right here. This would be the osteopenia, and this is osteoporosis. And you can just see how the bone starts to degenerate and decay away. So let's get into some solutions. So the first one is to balance your hormones. So we can do this. I do this in my office all day long. Let's go over the bone density and the difference between men and women, okay? So this is a graph that shows the density of your bone density. Women are right here, and then men. And you can see what happens right in here, basically from women right around 35 to, this is sitting here right around, I would just say around 65, 70. 65, 70, so you can see how the bone density really starts to drop. Well, what happens right here, ladies, at around 35 to 45? You start going into menopause, right? Perimenopause. Your hormones start to drop. Your hormones are key component to bone density. This is a graph. I like this. This is menopausal, so you can see your estrogen levels and you can see your progesterone levels. So right around 35 years old, women drastically have a decrease in progesterone, okay? And then you can see how estrogen lags a little bit and then it comes down. So generally women are what we would call estrogen dominant, because you can see here the estrogen is always higher than the progesterone. But at the end of the day, between this range here, your estrogen and your progesterone go down drastically. Now let's just correlate this with what's happening right here. Look what happens when women's bone density starts to go down. It's right during menopause when your robust hormones start to decrease. So hormonal balance is very, very critical when it comes to preventing, stopping, and reversing osteoporosis. So estrogen and osteoporosis, a direct relationship. So here's your estrogen levels over time, right? So this would be like 50. So when you're going through menopause, your estrogen levels kind of spike all over the place. And then here they just bottom out. So during menopause, estrogen levels decrease in the body, okay? Breaking down bone at a faster rate. So just that sentence is a little confusing. So during menopause, estrogen levels decrease in the body, breaking down bone at a faster rate. So what is that telling you? That's telling you as your estrogen decreases, guess what's going to start to increase? Miss what? Miss Pac-Man is going to start to increase. When Miss Pac-Man starts to increase, it's going to start to cause osteoporosis in your body. Oh, there it goes. So Miss Pac-Man increases. It starts to break down your bone tissue. You have the start of osteopenia, which eventually goes into osteoporosis. So this is from estrogen, okay? Without enough estrogen in the body, bone degeneration will occur more rapidly, resulting in osteoporosis. Again, this is the levels of your estrogen levels, okay? Now we have, your body's a symphony when it comes to hormones. We have the estrogen, and then we have the progesterone, okay? So all this stuff here, as I go through this, all this is medical research fact. I don't go through every research study because I'd bore you to death, okay? So progesterone in your body builds bricks, okay? So estrogen is building bricks. So we have estrogen, which slows down Miss Pac-Man, which is the eating away of the bone. And then we have the progesterone, which increases bone building. So you can see this symphony starting to happen. So this is a test that I do in my office. This is a 59-year-old female. These are saliva tests. We're checking hormones through saliva. You want to check hormones through saliva, not blood. You want to apply these hormones topically. These are bioidentical hormones, ladies. These are God-given hormones in the exact same amount that God designed you to have these hormones in your body. So here we have before and here we have after on bioidentical hormones. So this woman here came in. Now remember, progesterone is the brick layer. She came in at 11. Here we want this to be between 500 and 3,000. I like to see this around 1,200. So we started her on some supplementation, which is bioidentical hormones. You put it on the skin. We got her up to 421. Much better than 11. What did we do with her bone building? We increased her bone building. We gave her the nutrient that builds bone. Now, progesterone, I have a whole 5-part series on balancing your hormones that I can give you a link to. So right there, what did we do? We increased bone building. And then look at her, her estrogen right here was 1.52. Now we want, these are the optimal conditions right here, right? Is 1.5 to 10. So we got this more in an optimal range at 7.53. So what does estrogen do? Estrogen here slows down Miss Pac-Man. So we've slowed down Miss Pac-Man, which is eating the bone, so your bone lasts longer. And then what have we done is we've caused more bone to be laid down by laying the bricks. This is one component that we've done here so far, and we've drastically changed the hormones, besides all the other effects that you get women get on being on bioidentical hormones, such as feeling more youthful, healthier skin, healthier hair, more zest for life, just more of a feeling of youthfulness. Sex drive will increase, libido starts to increase. All these things just on bioidentical hormones, and this is just one component. Step 2 is food sensitivities. This is a test that I do in my office. This is a blood test. We check to see if you have sensitivities to foods. We prick your finger and I take 11, 12 vials of blood. I send it to the lab. Now, what this is here is we're checking to see if foods in your body cause you to be inflamed. Okay, so we're not talking if you ever gone to the doctor and they pricked your back with like to see if you're allergic to like pollen or like, dust or whatever. This is something different. What this is showing is every time you eat these foods, this causes a low-grade chronic inflammatory process in your body. So what this shows, you see 0 to 6 right here. So we want to eat foods that are 0 to 1. Anything here in the 2 category and above causes you to be inflamed. Now remember, if you're inflamed, your bone is going to start to decrease. The bone density is going to start to decrease. So if you're inflamed, you increase Miss Pac-Man, which is going to eat the bone, right? And guess what happens to your brick layer? You decrease your brick layers. So this is a perfect setup for osteopenia and then osteoporosis. Now look at this. This is dairy. You see this? So the milk in your industry said, drink milk for bones, bones, bones. This is completely false. Okay? Calcium from bones is not the ideal calcium to be taking. You want to get calcium from vegetables, green leafy vegetables. That is going to absorb in your body, and it's not going to be an inflammatory process. Milk is an inflammatory process. Look at this world right now. We're the only species that drinks another species milk, and we drink it not when we're babies, but when we're adults. No other human, no other species on planet Earth drinks someone else's milk when they're in their adults, or even for that matter, when you're babies, you're not drinking anyone else's milk, any other species milk. So these are pro-inflammatory molecules, especially milk from dairy, causes you to be in a state of inflammation. If you're in a state of inflammation, you increase Miss Pac-Man and you decrease builders. So we check 96 different foods right here. Here's another one. We check in eggs. So you want to look at this is why are you inflamed? Why is your body breaking down? It's just not a matter of here's some Fosamax. We did a bone density score and your osteopenia, take this medication. That's not the way to go. So here I've developed a huge library, a huge curriculum of education. So how leaky gut? So these food sensitivities, if you're sensitive to the foods, this tells you that you have a leaky gut, that you're chronically inflamed. So this is a 24-minute video on this. I'll give you the link if you're interested to know more about what leaky gut is and how this causes inflammation here. This is autoimmune disease, but you could say leaky gut and osteoporosis, leaky gut and fibromyalgia, leaky gut and thyroid problems, leaky gut and autoimmune disease. So leaky gut is not good, and we talk about your small intestine. We say leaky gut, we're referring to your small intestine right here. Okay, solution number 3 here, are you inflamed? So let's go over some research and what this research actually states. So where I highlighted the highlights here, let me just kind of go over some of this stuff here. So so this is a study. Okay, these are just research studies. Okay. So changes such as inflammatory modifications importantly account for age-related bone loss is gaining increasing interest. So they've done research. If you're inflamed, your bones start to degenerate. You can read all this stuff here. So inflammation is related to, it's what we call inflammaging. So inflammaging, if you're inflamed, you age quicker. Inflammaging, okay? Inflammaging has been associated with heart disease, diabetes, and Alzheimer's disease. So let's measure if you're inflamed. If you're inflamed, let's keep track of that to see if we're actually decreasing your inflammation. In this article, we first present the factors that condition inflammaging and propose the hypothesis that inflammation may be a driving force in age-related bone loss and even be responsible for osteoporosis due to what? Estrogen deficiencies. Finally, we discussed the possibility of pro-inflammatory biomarkers, which is what is a biomarker? A biomarker is a lab test. We did this test. It shows that you're inflamed. Let's figure out why you're inflamed and decrease that. Not with drugs, but with supplements. Supplements are more powerful than drugs. Let me state that again. Supplements are more powerful than drugs. Now, how can that be? Because when you take, for example, magnesium, magnesium works on 400 different pathways in your body. 400. Okay, if you take a cholesterol medication, guess what? It works on one. So when we look at this polytherapy approach in functional medicine in my office, we're handling, it could be 300-400 different enzymatic pathways in your body. So finally, we discussed the possibility of pro-inflammatory markers may be used to provide clinical information for identifying patients' risk for osteoporosis. Here's a marker I take. This is called high sensitivity CRP. So what we want this here is functionally, okay, so when I look at labs, I'm looking at labs as how labs are read on what a normal healthy human being would be. So I like to see this lab right here less than 1. Okay, now you can see when she came into me here, she was 19. So she was 19 times higher. It's like a ridiculously amount of inflammation in her body. We did some protocols, then we measured, okay, basically 5 months later, it's down to 13. So what does this tell us? This tells us that we took a marker, we checked for inflammation, you're inflamed, we did some modifications, and now she's down by 6 points. So this right here, these are some labs that show inflammation. This is an inflammatory marker. This is an inflammatory marker. A1C is a glucose marker. If you're pre-diabetic, that causes inflammation. If it causes inflammation, your bones start to deteriorate quicker. Homocysteine is an inflammatory marker. Fibrinogen is an inflammatory marker. High sensitivity CRP is an inflammatory marker. That's this right here. Your vitamin D status. Let's check your hormones. Let's check your fasting glucose. This is the information that we get out of here when we do the blood work to see exactly how your body's functioning, what's going on. So here's just some labs. So this is vitamin D on my patient. Came in at 16. Now you can see here this lab range here. Let me just erase that. I mean, you can see that, right? It's 30 to 100. 30 to 100, okay? So if you go to the conventional system and you have a vitamin D of 31, they're going to tell you you're what? You're completely fine, right? They're not going to mention anything to you because your vitamin D here, because your vitamin D is 1 point over the lab, so you're normal. The research shows is you want this around 80 to 90 when we talk about preventing osteoporosis. So we need to supplement that and the right dose, the right time, the right order. Then you want to recheck. So this is before and this is after. So we want to recheck to make sure our marker is going up. We want this in an optimal condition. Here's another marker of homocysteine. This lady came in. Now, I like to see this around 6, this marker right here. You can see here the lab range here. See how it says 10.4? That's the lab range, but what are we looking for in optimal condition? We're looking for 6 or less in an optimal condition, right? So she came in, boom, boom. We didn't get any changes. Then we started changing her program, and then we dropped this from 19 to 6. Homocysteine is an inflammatory marker. If you have high homocysteines, your bone is starting to degenerate quicker. Your brain is not functioning the way it should be. Your arteries are inflamed, right? So all these are inflammatory markers. I just wanted to show you some research studies so you know it's not my opinion. This is 2004. Here it says the higher levels of C-reactive protein, which is this marker right here, okay, which I check on all my patients. The higher the level of C-reactive protein and inflammatory marker are associated with an increased Fracture risk. Okay, so let's measure it, but now you measure it. Now what are you going to do about it if it's high? Here's another study, new study, 2016. Relationship between serum inflammatory marker and bone mineral density. So what's bone mineral density? We're referring to this, your density of your bone. So here's healthy bone, here's osteoporosis. Okay, the CRP concentration was significantly higher in the decreased bone mineral density. So here, it's saying this person right here, your CRP was what? Increased. You're inflamed. It decreases bone osteoporosis. Okay, why are we inflamed? Okay, this right here. Okay, I put this on here because I've been in practice now, 2 decades, and the biggest thing is when it comes to people being inflamed is your GI system. Okay, so I'm going to tell you what healthy GI system should be. Okay, or healthy GI system colon movement. Okay, so you should be making 2 to 3 bowel movements every single day, day in and day out, 2 to 3 BMs per day, okay, day in and day out. You shouldn't have constipation, you shouldn't have diarrhea. It should be consistently across the board. You shouldn't have any gas, bloating. You shouldn't feel like when you eat, you bloat up. You shouldn't have any heartburn. You shouldn't be on any protein pump inhibitors. If you're on any of those things, that's telling you that your digestive system is not working and you're inflamed. 80 to 90% of your immune system is located in your small intestine, which is about 36 feet long. Okay, let me just say that again. 80 to 90% of your immune system is located in your small intestine, which is 36 feet long. So if your immune system isn't working right, if your immune system is upregulated, guess what you're going to be? You're going to be inflamed. Okay, so we need to figure out why you're inflamed. The digestive system is huge. You got to figure out your digestive system. If your digestive system is not working, guess what? You're not going to be able to absorb minerals. You're not going to be able to absorb that calcium. You're not going to be able to absorb the B12. You're not going to be able to absorb the manganese or whatever mineral it is to put down in bone. You're not going to be able to absorb it. So you got to fix your digestive system. Solution number 4 is, do you have enough hydrochloric acid in your stomach? So this is a picture of your stomach. As people age, you produce less hydrochloric acid in your stomach. So in your stomach here, the stomach lining right here, okay, produces what we call HCl, stands for hydrochloric acid. Hydrochloric acid, see this is gastric juice right here. This is a graph. So 1, pH of 1. So here's battery acid, and here's your stomach to your acid. Or here's your stomach acid is 1. Here would be like bleach is 9. So we need hydrochloric acid to break down food, to break down minerals, to break down calcium. If your stomach acid is sitting up here higher in this range right here, guess what? You don't have enough hydrochloric acid to break down your food. So when your food moves from your stomach, it's totally not broken down. So when it moves from your stomach and your small intestine, if it doesn't have enough hydrochloric acid, there's a whole bunch of digestive enzymes that are turned on by proper HCl. Okay, meaning that if you don't have enough hydrochloric acid in your stomach, it doesn't, when the food gets in your small intestine, it's not acidic. There's no acid in there, and it doesn't turn on the digestive enzymes that break down food further. Okay, so again, this right here is Spectrazyme. This is a product that I use. It's HCl. Okay, it's HCl. Some people need to supplement with HCl with every meal. Why? Because they just don't produce enough. As you age, your HCl production goes down, or sometimes people have a genetic problem where they don't produce HCl. So I've been in with patients and they've had digestive problems since they've been 15, and now they're 55 and they have all these problems. And one of the things I do is I put them on HCl and things clear up magically because they didn't have enough HCl. So I've created a video here. Again, this is 15 minutes. Do you have enough HCl in your stomach? I go through what we call the HCl challenge. You do this at home. You can determine on your own if you have enough hydrochloric acid in your stomach. You just follow the 15-minute video. Okay, supplements now. So this is a study. It's called the Comb study, and here's the PDF of it. Okay, this is a really great study. So this is a study of basically like 5,100 women that had osteoporosis, and they compared basically what they say bone density after micronutrient intervention. So what they did is they had 1,500 women take these specific nutrients versus people on Fosamax. So they had two groups, one that did supplements, natural supplements, and one group that did Fosamax, okay? So what did they take? They took DHA, which is part of fish oil. These are very small doses, 250 milligrams. They took vitamin D, which is 2,000 a day. They took vitamin K. I'll be going over that. Strontium, which is a new upcoming supplement on the marketplace. They took 680 milligrams a day. They took magnesium, 25 milligrams per day. And guess what? They didn't even take calcium. They got calcium from what? Vegetables. So they didn't take calcium they didn't take calcium supplements, or they didn't drink a gallon of milk a day. And they had daily impact exercise. Okay, so this was their regimen, okay, on this Comb study. And guess what they found is that people on this right here did better, had less fractures than people on Fosamax. And it's all right here in this study. Okay, you can look at that study. I'll have the PDF there so you can look at it if you want to look at the research studies, just so you know it's not like Dr. Hugh's opinion. So this is strontium. This is a product that I recommend for my patients here. So this right here, so strontium helps support osteoblasts, which is, you remember the osteoblasts were the bricklayer, and helps keep osteoclasts in balance. So what does this do? So this increases osteoblast activity, which is bone laying, and then it slows down osteoclast and Miss Pac-Man, the bone degeneration. So here, one of the things with this here, since strontium is absorbed using calcium transports mechanism, strontium should be taken away from calcium. Okay, so you don't want to take strontium with calcium, because calcium and strontium use the same, they use the same transporter system. Okay, what's the deal with vitamin K? Okay, so I've now giving patients vitamin D with calcium. Okay, so this is all the benefits of calcium, or of vitamin K. So improves bone density. So what happens here is you have your bone. This is just, I don't know, this is a poor bone. Okay, so then we have your blood. So we have calcium here. That's calcium. Then we have vitamin K. Okay, this is vitamin K. So what vitamin K does is vitamin K grabs calcium and helps calcium be deposited into the bone. So if you don't have enough calcium, or if you don't have enough vitamin K, the calcium sits in your arteries, all right? So it sits in your arteries and starts to clog your arteries. So what vitamin K does, it grabs the calcium and puts it into your bone. Now, there's very specific vitamin K that you want to take with your vitamin D, but it helps with PMS, fights cancer, helps blood clotting, improve brain function, helps maintain teeth and gums. So this is just vitamin K. So you can see here the functional medicine approach. It's a holistic approach. So these are the top nutritional support nutrients for osteoporosis or osteopenia. Now, there's a lot of them. And what do you need to take? To be quite honest with you, like, I don't really know what you need to take. That's why the functional medicine approach, like when people come into me, it's very, very specific. All I know is these things right here are a broad spectrum of nutritional supplements that you need to take to make sure that calcium is being deposited from your blood into your bone. And you can see there's many, many, many different things. I mean, bioidentical hormones, there's the HCl capsules, there's handling your gut, there's handling the inflammatory process. So all these things are real critical. So for example, like omega-3 fatty acids, that decreases your body's inflammation. That decreases body inflammation. If you decrease your body's inflammation, guess what happens to Miss Pac-Man? They start to decrease. Guess what happens to the bone builders? They increase. Okay. Same thing with vitamin B12. That decreases your inflammatory process, your homocysteine levels. It helps with DNA function, right? So when we talk about functional medicine, I'm talking about getting down to the cellular level, working with the DNA components of your body, because DNA makes things. If you don't have good DNA, guess what? The cells just are not healthy. So these are all the things that are needed here. These are all the things that are needed here to actually get your bones up and going. But at the end of the day, the functional medicine approach is an individual custom tailored plan for your specific needs. Of course, I can't say enough about exercise, right? So how does exercise work? This is just your bone right here, okay, this is your bone. If you put pressure down on your bone and your bone is going to register that, it's automatically going to deposit more calcium into your bone. So exercise is a key component. So just to kind of summarize what we have here, functional medicine in my office is an individualized, custom-tailored program. We look at you as a human being, not just as a number, not just as here's Fosamax, and we evaluate you and figure out what's actually going on with your body. Do you have not enough hydrochloric acid in your stomach? Are you not able to digest food? Are you not able to break down food? Are you not able to break down food and actually get the calcium in your body and put the calcium into your bone? If you're chronically inflamed, your cells aren't healthy. If your cells aren't healthy, your cells aren't even receptive to the nutrients. So you have bone cells, right? So if you're inflamed, your bone cells aren't healthy and they can't even take on nutrients. So do you have a bad digestive system? Are you making 2 to 3 bowel movements every single day? Are you pre-diabetic? Do you have high insulin levels? Do you have high glucose levels? Do you have high A1C levels, which is a 90 marker for glucose? If you're pre-diabetic, if they've told you that you're pre-diabetic, or you have high sugar levels, you're inflamed. That's what the medical research shows. If you're inflamed, you have increased Pac-Man, you have decreased bodybuilders, or you have decreased bone builders. Are your hormones non-existent? Did you go through menopause, ladies? This is a key thing. Did you go through menopause very early, like let's say in your late 30s or early 40s? So the earlier you go through menopause, like the sooner you have an absence of this estrogen and progesterone, the longer you have an absence with that, the more probability you're going to have osteoporosis. Did you go through menopause all of a sudden, like boom, one day you had a period and the next day you didn't? People that go through menopause very quickly and in abrupt cycles of hormone stop, that can cause osteoporosis. What kind of diet do you have? Are you eating a bunch of carbohydrates? Are you eating cereal? Are you eating, are you eating foods that you're inflamed to? Are you inflamed? What foods are you inflamed to that's causing chronic inflammation? So you can see at the end of the day, functional medicine gets to the root cause of the problem and you can get better. You don't have to be taking Fosamax. You just need a functional medicine approach that's workable, and you get the education so you'll understand what's going on. So if you want some help, this is my number right here. This is my email. In this video on the web page, somewhere along here, you're going to see schedule a $47 consult. Just click this and we'll take you to a page where you put your name, email, number in, and I'll have my office staff get a hold of you. But at the end of the day, I just want to let you know that you can get better. You don't have to worry and fear of becoming osteoporosis and falling and breaking your hip. And that's a horrible, horrible way to have anything happen is breaking a hip. Take care, and I hope you found value in this.